To invite the next speaker, Dr. Subhash PRASAD, who is a senior ophthalmologist at Patna, senior consultant at Dividrishti Eye Hospital, and he'll be speaking on EDOF and extended range of vision IOLs. Dr. Subhash PRASAD.
Thank you, Dr. Satyajit, for including me in this this IC. The history of IOL dates back to 1949, when this gentleman just first implanted the intraocular lens, which was, since it was a first, so there was a lot of post-operative surprise. And as the age of the patients are advancing and the need for the near or intermediate visions are increasing, the most of the patients nowadays are they actually looking for the spectacle independence and intermediate vision for their daily activities apart from the excellent distance vision. And it was rightly coined some decade back by Lindstrom that the first complication of the intraocular lens is presbyopia. So modern day cataract surgery, the fundamental challenges are to provide a good vision for all distances, distance, intermediate and near, with the preservation of optical quality and reduction of the night vision problems. As we see the evolution of lenses, it was monofocal to start with, then the bifocal, then trifocal, and later on came the EDOF. But what was left was the unmet needs with the trifocal lenses, like the quality of vision, which was not as good as the monofocal vision. It had lot of problems. It has still, there are lenses which are trying to decrease the problems in the trifocal lenses, but there are still some, these are the problems which frequently encountered in multifocal lenses. So what was required was the EDOF lenses. That was the need of the day, that most of the patients, they wanted some intermediate vision without any night vision problem. So not all lenses which are claimed to be giving some intermediate visions are actually EDOF lenses. That they have to meet the certain criteria, like NC criteria, which says that the depth of the focus should be more than 0.5 diopter, more than the monofocal lenses, and the distant corrected intermediate vision should be superior to a monofocal lenses. And nearly 50% of these patients should achieve 20/32 vision of the intermediate vision with the distant corrected vision, and it should not be inferior to monofocal lenses. So what the EDOF lenses do, that they create single elongated focal points to enhance the depth of focus, and since there is continuous focus, so there is no breakup of light, so vision is very good through the distance and in the intermediate, and with some workable near vision in some of the lenses. There is no loss of contrast, except that is said by all lenses, but there is definitely some loss of contrast in some of the lenses with the at least in these modern generations EDOF lenses, which does not use this diffractive technology, there is no chances of halogen glare. So what are the types of EDOF? There are some monofocal EDOFs, not a true sense EDOF IOS like Enhance, Magnificent. And the first one which was actually approved by the FDA was Symphony lens. That was a diffractive IOLs at Lija. Then there are pinhole EDOFs IOLs, not very commonly used, based on the technology of spherical aberration like mini well. Then based on the technology of upfront shipping, that is prototype is VVT. And nowadays the refractive EDOF are picking up the market, and the prototype which has come is the Pure C from the Johnson & Johnson. So premium monofocals are also termed as enhanced monofocal, monofocal plus, smart monofocals, and the prototype lens which came into the market first was the Technic Enhance, which was able to give very good distance vision and some amount of in the intermediate vision. But the problem is that this is technically not a EDOF lens, and you can see in the defocus curve that it could give just 0.6 diopter of the depth of focus with this lens, which whereas in the monofocal you can achieve with 0.5 diopter of the defocus. Another one was the Vivinex, the Ray-1 lens, which is in a hydrophilic platform, which was actually designed by Barrett. Actually there is change in the positive spherical aberration of the center of the lens, which causes the lens to behave in a way that it focuses for the intermediate vision and gives very good quality of vision, because there is no diffractive ring, so the night vision problems are not there. This is the defocus curve. It can correct up to 1.5 diopter of the intermediate vision. Another one which is available in the market is Evolux. These are not true EDOF lenses, but they behave and they give good amount of near intermediate vision correction. Then coming to the diffractive EDOF, which was first implanted and got the first FDA approved from the Johnson & Johnson, was the prototype, and it was in vogue for so many years, but it has gone out of market because of the night vision problems, because it is based on the diffractive principles. So there was some problem with that. The another lens which is there in the market, perhaps not in India, is the small aperture or pinhole EDOF IOL. There is central optical area of 1.6 diameter, which actually 1.3 diameter, which actually allows only the focus ray of the light to go into the macula, and thus eliminating all other lights, so the patient gets some intermediate vision. But the problem is that as the pupil dilates in myopic conditions, there is very less amount of light going into the eye, so the quality of vision is not good in the dilated eye or in the myopic vision or scotopic vision. So it can be used only in the non-dominant eye, but it doesn't give that much good quality of vision. So another technology which was actually invented was the wavefront engineering technology, where the spherical aberration was induced only in the central part of the when induced only in the central part of the pupil, increases the depth of focus to overcome the presbyopia. So this technology was used in the lens where the spherical aberration is induced, and the one which is well known is the mini well lens. Here central within the central 3 meter or 3 millimeter of the lens, there is induction of positive and negative spherical aberration, which actually elongates the light and creates extended depth of focus, which can correct up to 1.5 diopter of the intermediate vision. Another one which is in the market is the wavefront shaping. We all know about the VVT lens from the Alcon. It's based on the X-wave technology. It has got some alteration in the anterior surface of the lenses, which actually stretches and shifts the wavefront, creating a good depth of vision for the intermediate vision. And there are some loss of contrast, but the company claims that it can give you as good as any monofocal lens, but there is some loss. But the patient quality vision is very good. Nearly all of the patients are very much satisfied. And you can see the binocular defocus curve. It is performing much better than any monofocal lens of Acrysoft, the comparable counterpart. And it gives superior consistent visual acuity with all pupil sizes at all distances. The new lens which Pure C has come from the Johnson & Johnson is the refractive type of EDOF lenses. This is the first purely refractive EDOF IOL from the Technis on the Technis IOL platform. The optical features of the Technis Pure C IOL include it has got the anterior aspheric surface like of Technis, but there is changes in the posterior surface with a modified refractive design that allows the consistent depth of focus extension from distance to near, with nearly no dysphotopsia as compared to any other trifocal lenses or some of the EDOF lenses, and maintains excellent vision, and there is much tolerance to any change in the refractive error in the patient with surgery. So this is you can see the defocus curve. And it claims that there is no dysphotopsia, and I have implanted in some patient, but my experiences are most with the VVT and many other lenses like Renner, but this lens also performs very well. And just to summarize, there is growing need of spectacle independence from the any intraocular lens implantation. Multifocal lenses are good, but they come at the cost of quality of vision. So EDOF lenses are a good choice, particularly in those where you cannot advise this trifocal lens, like those patients who do night of driving or have some compromised macular pathology. In those patients, we can go for the EDOF lenses. And the current generation of the spherical aberration induced refractive EDOF IOLs, there is no vision problem. So the EDOF lenses are going to the future of the lens implantation, and particularly the refractive design and those with the change in the anterior surface spherical aberration. These lenses are going to stay as far as the EDOF technology is considered. Thank you very much.
Thank you so much. So at least the basic take-home message is that if you are starting to use premium IOLs, start with EDOF and not with trifocals, because EDOF lenses are more forgiving.